When a blood vessel starts to bulge or balloon over time and then ruptures, it causes massive bleeding. This is especially dangerous if it happens in a major artery. It is one of the deadliest conditions because person can die within minutes. This bulging of an artery is called aneurysm. An aneurysm usually develops in the brain or in the abdomen. About 2% of people have a brain aneurysm and around 5% have an aortic aneurysm in the abdomen. The main danger is that an aneurysm can be silent for years, but if it ruptures, almost half of those with brain aneurysm will die from the bleeding. The outcome is even worse with abdominal aortic aneurysm. 80% of patients die before they reach hospital. That's why I will tell you earliest signs, the risk factors and the correlations. If you know how to spot the warning signs, you can find an aneurysm early and treat it before serious complication happens. The primary and the most important risk factor for aneurysm is high blood pressure, also known as hypertension. This is the strongest direct correlation with aneurysm risk. Around 70% of people who develop an aneurysm also have hypertension. Elevated blood pressure damages artery wall, making them more likely to develop bulge or ballooning. Hypertension raises the risk of both abdominal and brain aneurysm, but the association is especially strong with abdominal aorta. People with high blood pressure are around 3 times more likely to develop an abdominal aortic aneurysm. For brain aneurysm, this risk is still significant, around 2 times higher than people with normal blood pressure. Smoking, whether current or in the past, is one of the strongest risk factors for abdominal aortic aneurysm. Associated with nearly 90% of cases, this makes it more influential than any other lifestyle factors. Smokers have about 5-fold increased risk of developing abdominal aortic aneurysm compared to people who never smoked. And this risk remains elevated for former smokers, also about double the risk. The primary mechanism is that nicotine and carbon monoxide from cigarette smoke damage the arterial wall, degrade elastic fibers, and trigger chronic inflammation. These changes weaken the vessel, making it much more likely to balloon out. The third important risk factor is a family history, especially having a first-degree relative with an aneurysm. This alone can double or even triple the risk, mainly due to inherited genetic weakness in the connective tissue or vessel wall. Age is another major predictor. The risk rises sharply after 55, and even more so after 65 in women. Men are especially vulnerable, being 4 to 5 times more likely to develop abdominal aortic aneurysm than women. Atherosclerosis plays a huge role. About 80% of all aneurysm cases are associated with plaque buildup in the arteries. Connective tissue disorders such as Marfan syndrome and Ehlers-Danlos syndrome make the risk up to 10 times higher compared to general population. In these conditions, faulty collagen and elastin mean artery walls are much more likely to balloon and rupture. And finally, heavy alcohol use is also a significant contributor. Studies show that about 50% of people with aneurysm have a history of heavy drinking, which accelerates vessel wall damage and increases the risk further. When we talk exclusively about brain aneurysm, also known as intracranial aneurysm, the strongest correlation is family history. People with a parent, sibling, or child who had brain aneurysm face 2 or 4 times higher risk themselves. There is also notable risk with polycystic kidney disease. About 10% of those diagnosed with brain aneurysm also have kidney conditions, although this connection is not as direct and strong. Female sex and age are also important. Around 60% of all brain aneurysm cases occur in women, and the risk rises after the age of 40. peaking between 55 and 60. High blood pressure and smoking remains significant risk factor for developing a brain aneurysm at any age. As for warning signs before ruptures, in almost 90% of cases there is no prior symptoms. However, about 10% of cases people describe experiencing worst headache in their life. In rare instances, symptoms such as double vision, pain above or behind eyes, drooping eyelid, or pupil changes may appear, usually due to aneurysm pressure nearby nerves. When the brain aneurysm ruptures, the classical sign is a sudden, extremely severe headache, often called worst headache of your life. This pain appears within seconds and is sometimes referred as thunderclap headache. Other symptoms include nausea, vomiting, stiff neck, loss of consciousness or confusion, seizure, blurred vision, double vision, sensitivity to light. In many cases, a person may become unresponsive within minutes. The gold standard for diagnosis in this situation is computed tomography CT scan performed without contrast. This test can easily detect bleeding. If CT scan is negative but suspicion remains high, the next step is lumbar puncture to check for blood in the cerebrospinal fluid. Once bleeding is confirmed, the exact location and the shape of aneurysm are most precisely identified by cerebral angiography. Urgent hospitalization is absolutely critical for survival, with immediate blood pressure control, if possible neurosurgical intervention. Life-saving procedures include surgical clipping or vascular coiling, both of which stop bleeding and help prevent rebleeding. Without treatment, about 50% of people die within days, but early surgical care can lower the death risk. It is possible to detect aneurysm even before ruptures by magnetic resonance angiography or CT angiography. Screening is especially important for those with first-degree relative who has aneurysm, or in people with polycystic kidney disease or connective tissue disorders. If a brain aneurysm is discovered before it ruptures, the best way to prevent rupture are to stop smoking, control blood pressure, and avoid heavy alcohol use. For high-risk aneurysm showing growth or causing symptoms, prophylactic surgery is needed, like clipping or coiling. Now let's say about aortic aneurysm. Still, they are asymptomatic until they grow very large or rupture. About 80% cause no symptoms at all. If symptoms do appear, they may include a pulsating sensation near navel region, in the deep abdomen, persistent abdominal or back pain, or abdominal tenderness and fullness. If an aortic aneurysm ruptures, sign becomes dramatic and includes sudden, severe abdominal or back pain. The pain can radiate to groin or buttocks or legs, dizziness or fainting, a rapid pulse, cold, sweaty skin, and severe drop in blood pressure which lead to shock. For abdominal aortic aneurysm, screening is recommended for adults over 65 who ever smoked. If the aneurysm is small, monitoring with ultrasound every 6 to 12 months is standard. When aneurysm is larger than 5.5 centimeters or it is growing rapidly or causing symptoms, surgical intervention is important, either endovascular repair or open surgery. The simplest and most effective way to screen abdominal aortic aneurysm is an abdominal ultrasound. This test can detect almost 90% of aneurysms that are larger than 3 centimeters. Screening is recommended for all men aged after 65. For women, routinely screening is not advised unless there are multiple risk factors or strong family history.